Welcome again, the rest of the delegates who wish to join us in our business panel. So we move on to a business panel, which is a unique panel discussion. This is a collaboration work by the Arab Thyroid Association, which is a nonprofit organization. This panel will aim at addressing knowledge gaps, increase awareness among healthcare providers, and improve clinical practice in the field of thyroid in the region. That can only be accomplished following case identification of disease burden and morbidity rate discovery. Tonight, we host experts from Africa that I am honored to introduce. We are also honored to have a big number of delegates joining us from Africa. Welcome our colleagues, delegates. As you know, there are challenges and obstacles towards providing standard care in low-income countries, and we choose to shed light and provide guidance into how to improve medical care in the region. So without further ado, I would like to introduce our experts from Africa. First expert, Professor Hind Iraqi. Professor Hind Iraqi is a professor of endocrinology and metabolic disease from Rabat, Morocco. The Department of Endocrinology and Diabetes at Ibn Sina Hospital in Rabat. Welcome, Dr. Iraqi. Our second expert would be Dr. Kirtida Acharya. She's a consultant endocrinologist from Nairobi, Kenya. And she is the chair of the National Diabetes Center in Shah Hospital, Nairobi, Kenya. Welcome, Dr. Acharya. So, as you know, this gathering will help initiate a collaborative work into addressing gaps in clinical knowledge in order to improve clinical care among providers. So let's start off by asking Dr. Professor Iraqi, Hind Iraqi, can you outline or shed light on the existing obstacles or barriers in the thyroid disease in low-income countries, specifically in Africa? So I want your experience based on your clinical practice, and also I want your opinion where you have been attending International Thyroid Expertise Congress. Go ahead, Professor Iraqi.
Thank you very much, Professor Al-Saddiqi, for this kind introduction, and thank you for giving me the floor. So I'm Dr. Hind Iraqi, and I'm very pleased to share an African perspective on a topic that remains far too often overlooked. I will briefly highlight the scale of the problem, the main barriers we face, and why this is the right time to act. So as you see in the slide, thyroid disorders are a major but still neglected public health system issue in Africa. And what is striking is that many of these conditions are preventable, diagnosable, and treatable. And they still receive far too little attention in national health priorities, especially in Africa. Data from across Africa are still limited, and even with this limitation, the available evidence is already worrying. Goiters, they remain highly prevalent in many settings. Hashimoto's appear frequent in reported studies. And this is not only a clinical issue, it's also a health system issue, an equity issue, and a policy issue. Let's begin by one of the first drivers of this burden, which is iodine deficiency. It remains a major challenge in Africa. Many countries have salt iodization laws, like in Morocco, but implementation is still uneven. In Morocco, it's okay, but in many other countries, it is not the case. So the problem is not only policy and paper, it's also enforcement in real life. And this is especially important for pregnant women who remain one of the most vulnerable groups. So iodine deficiency is still very much a current public health issue. And it's not the only one. The second gap is the newborn screening. The newborn screening for congenital hypothyroidism is still extremely limited in Africa, and this is really a missed opportunity. Congenital hypothyroidism is one of the most preventable causes of lifelong intellectual disability, and if you diagnose it early, we can change the whole life trajectory of that child. But national screening programs remains rare, and the barriers are familiar: limited lab capacity, weak sample transport system, early discharge of newborns, and low political priority. So this is clearly an area where it is a relatively simple intervention could have a major long-term impact. And another visible part of the burden is goiter. Of course, goiter is still highly prevalent in many parts of Africa, but it is not only a medical problem, it is also a social one. In many settings, especially for women, goiter can lead to stigma, exclusion, and even delayed care. And this is made worse by distance from health facilities, cost, and persistent misconceptions about thyroid diseases. So when we talk about goiter, we are also talking about stigma, access, and the need for education. If you want to see more broadly, access to thyroid care remains a major challenge. Access gaps affect diagnosis, treatment, and long-term care. In many countries, thyroid tests, imaging, medicines, and even specialist visits are still too expensive for many patients. And at the same time, the specialist workforce is limited, and services are often concentrated in major cities, leaving rural population behind. And even when we want to improve care, then we face another major problem, a big one, the lack of data. So Africa has a lack of robust local data on thyroid diseases. In many countries, surveillance data are outdated, incomplete, or simply unavailable. And this really matters because if a disease is not well measured, then it's very hard to make it a policy priority. And beyond data, we also need strong governance advocacy. This advocacy is very important. This is the final gap. Africa still lacks a dedicated continental thyroid association, and thyroid disorders are still not sufficiently visible in many NCD's agendas. At the same time, patient advocacy remains limited in many settings, and even clinicians, they often work with guidance that is valuable, but not always adapted in our low resources realities. So we need stronger regional leadership, stronger advocacy, and better coordination if thyroid health is to move higher on the public health agenda. This is why the next step is not only to describe the problem, but to move forward to have an action. The reports point to several practical priorities: prevention, newborn screening, better access to care, stronger awareness, more research, and stronger governance. What matters in that action should not happen in isolation. They need to be part of a broader strategy, a strategy that links prevention, diagnosis, treatment, affordability, and policy recognition. And that is also where the global framework becomes useful. And in addition to the Africa-focused report, I would briefly mention the Global Thyroid Action Framework that I took part with my friend Kirtida. It is important because it identifies policy action not only for Africa, but more broadly for low and middle income countries. It also gained visibility through a World Health Summit event, which shows that thyroid health is increasingly being recognized within wider global health discussion. And for 2026, the focus is clearly on implementation, regional roadmaps, and continued advocacy. And thank you.
So this is very interesting because Dr. Iraqi, we do share the first challenge, which is iodine deficiency. Our country was termed an iodine deficient area. But by 2009, because of the government effort in measuring, increasing awareness, and implemental guidelines and the proper practice, we have been termed minimal deficient in iodine in the year 2009. So this is very interesting. I think lifestyle and genetics are shared among what you have said. And you have presented beautifully a recap of the steps towards decreasing the burden of a disease. Thank you very much. Let's go and ask our expert, Dr. Acharya. In your opinion, Dr. Acharya, based on the data presented in International Thyroid Congress last year, so I want to hear your input or your analysis related to the data presented in the Congress last year. And if you can connect that to the disease burden in Africa, and how can your analysis as an expert from Africa, from the region itself, can help towards improving the clinical care. Dr. Acharya.
Thank you, Dr. Ayman. I'm very happy to be part of this discussion today at the 5th Arab Congress. So we met in Rio de Janeiro in June last year. Experts from across the globe, the AOTA, the ETA, ATA, and the LETS. We had the presidents of those societies. We were very humbled to present before them. Professor Hinde, Professor Fasamande, and myself as the key opinion endocrinologists representing Africa. And we had a roundtable discussion together with the ITA. And after this presentation, a paper came out, an editorial, about the Uniting Continental Thyroid Societies, the 54 countries in Africa, which is a very varied continent. What could we do to address the challenges that Hinde just presented? All the challenges that we face in Africa, how a call to action came out, and we are very happy that now, we need to move to come out with guidelines for Africa. What can we do? What can we put on the table? And as a result of this, now we feel we are moving forwards as a continent with every challenge. We feel an opportunity is out there. And besides iodization of salt, we have all this epidemiologic data, lack of data. How can we consolidate this together as a continent to move forward? So a paper came out of this with some, valid timelines as to what we can do as a continent. So this is what I would like to present in the next few slides. If we can move on to the next slide, please. So what happened at the round table? It was a very fruitful discussion, very interesting, very challenging, and very inspiring. So at this global round table, we all put our heads together, dreams were born, and I think every dream is valid, as Lupita Nyong'o from Kenya says. And we all put our heads together, we had a dialogue, we put across our challenges, brainstormed what opportunities could come out. So we had the experts from Morocco, Nigeria, and Kenya, and then we had support groups as well, the sister associations I talked about. And our goal was to foster better understanding, where are the challenges, where are the unmet needs, what are the issues? Is it in diagnosis? Is it in management? We are talking about a low middle income resource continent. And how can we overcome these barriers? And at the end of the roundtable, it became a seed. It became a huge momentum. What can we do? And this became really a snowballing, effect. And right now we are actually writing guidelines as we speak. For the whole continent. And of course, we'll have to do it in different languages because, as you know, in Africa, there is Swahili, there is English, there is Arabic, there's French, and we are in the process of doing these guidelines. So if you can just move on. So Hinde was presenting the challenges, and I'm hopefully trying to come up with the opportunities, because in every challenge, there is a hidden opportunity. So the challenges Hinde has already talked about the lack of epidemiology, neonatal screening not being present in every country. Professor Kopp spoke about Algeria having some screening, but not every country in Africa has the screening. Lack of education material. Africa, with its cultural beliefs, every country has a lot of myths that we need to bust as healthcare practitioners. But as a result of this, we are looking at health policy actions. How can we implement salt iodization. So congratulations to you, Dr. Emin, for what you have achieved. In Kenya, we do have a salt iodization program, but not every country in Africa has that. So we need to borrow from each other, borrow a leaf from each other for every country to be up to scratch. Then inclusion of thyroid diseases among the NCDs recognized by the WHO. We also want an African chapter in the International Thyroid Federation, to have a chapter there where we would be represented. The cost of tests is really, really something which really affects everybody in Africa. So reduced cost of testing, interpretation of the testing, whether it's subclinical hypothyroidism, thyrotoxicosis, we need to put all the medical practitioners up to par. So validation of laboratory testing as well, radiological reporting, availability of thyromobile clinics, ultrasound screening, the vulnerable groups, whether it's elderly, pediatrics, pregnancy, we wanted to inclusivity of all the patients, empowerment of patients. Not every country in Africa has thyroid support groups. So we wanted to also include the patients in our call of action. And then thyromobile programs to reach the hardship areas. We know geographically and politically and economically, not everybody in Africa is able to access the programs. So if we can move on. So Mark is doing a lot to help us also reaching the patients with the thyromobile clinics and the thyroid app, the T app, which is available on the phones. If you could just move on to the next slide, please. Okay. So this is a photo that we have of the round table. And we were just all very excited with all the ideas we put forward. And like I said, right now, currently, with this call to action, we've already started writing the guidelines. The experts are putting in their inputs for hypothyroidism, hyperthyroidism, thyroid in pregnancy. And we look forward to coming up with some solid guidelines so that thyroid diagnosis, management, empowerment of patients, all this happens, and our dream and our thyroid, our thyroid association for Africa is a reality. Thank you.
So all of these topics you've mentioned were presented today and yesterday in our Congress. Thyroid disorders in pregnancy and pediatric session was dedicated for addressing thyroid diseases in the pediatric population. Now, interestingly enough, the myth that you've mentioned in Africa, we do have a myth at a different level. The social media, after optimizing iodine level here in the Gulf region, particularly the UAE, the United Arab Emirates, the social media now is advocating against the iodide salt, and it's advocating for the use of the Himalayan salt, which is non-iodized, which we shouldn't use in our region with iodine deficiency. So excellent point. Professor Iraqi, is there any initiative going on apart from what Dr. Acharya has been saying and mentioning?
Yeah, thank you again. We face the same problem with the Himalaya salt here in Morocco and with the social media. So we really need to go more in the social media to ask the people to take the salt which is iodized. So this slide is about moving from vision to action, about turning this momentum into something very concrete in Africa. The idea of TOFA, which is Thyroid Organization for Africa, and this TOFA was the idea of my friend Kertida. It reflects the need for a stronger continental platform for thyroid health, such as the platform bring together clinicians, researchers, patient groups, Ministry of Health, and even partners around a shared agenda. It could support training, advocacy, African adapted guidance, and multi-country collaboration. So the message I would leave today is very simple. Africa does not lack expertise. Your Congress is a very nice one, and the topics are very relevant. Africa does not lack commitment. What we need now is stronger coordination, stronger ownership, and collective action. And thank you very much.
I agree with you that not every nation would adapt outsiders' ideas and policies. probably by introducing the TOFA acronym. And if it means anything, maybe we can reach their heart and mind. So can you tell us what TOFA means in one of the African language, please?
Go ahead,
TOFA
Kertida.
means a gift. There is a song that says TOFA, TOFA, TOFA. So TOFA actually means a gift. So it's a gift that we want to give to all the people living in Africa, a gift for excellent thyroid health, availability of tests, availability of experts, availability of good care. Everybody deserves good thyroid health. So it's a gift to all the people living in Africa. Doesn't matter whether they live in the mountain, they live in by the sea, doesn't matter where they live. Everybody deserves the gift of good thyroid health. It's a gift we want to bring to people, a dream.
Yes, and probably we can start from there. So thank you very much for this very valuable input in relation to the thyroid disease in Africa. I was really enlightened and glad to learn about similarities between Africa and some of the Gulf countries. And I hope that we collaborate in the future, and we're always there by your side for any educational activity or collaborative work. Thank you very much, Professor Iraqi and Dr. Acharya. Thank you for the invitation and organization of such a unique panel. Thank you.
Thank you.
Thank you.